We are in the midst of a fentanyl crisis in a way that our community has not seen ever before.
When OxyContin became very toxic in our community in the early 2000s, the doctors were prescribing OxyContin like candy. So we historically were a community fighting alcoholism, and we became a community fighting opioids.
One night I turned on the TV and I start watching the news and was talking about the homeless encampment and the drug activity that was happening around City Hall in Bellingham.
Leon John came to me after he'd watched the news broadcast, and he had a very strong feeling that Bellingham was asking for assistance. He was real clear that we could provide that assistance.
2013, I lost my oldest son to an overdose, heroin overdose. And at that time, we lost 4 in the same week. We had 33 people walk into our little wellness center over there saying, I want help, I need help. And then when we're doing my son's funeral, the former chairman of the tribe, Brian Clasby, was asked me, he says, here's how do we want to do this? I said, this has to stop. This has to stop. We have to let our community know that we are here and we need to help them.
We couldn't wait for what I call the Great White Hope to come rushing in. We couldn't wait for Kevin Costner to come in and rescue us. We couldn't wait for a grant to come in. We couldn't wait for the next cycle of funding to come in. We had to immediately do something to help our community and our community members. And so we set aside $1 million and said, here, create a program. This has to stop.
The didgʷálič Wellness Center is conceived as and operated as a comprehensive, intensive outpatient treatment program for people with opiate use disorder, including chemical dependency services, medication-assisted treatment, primary care, dental services, child care, and transportation.
I have my own experience with substance use disorder. I was one of the people that were going to outside services that we weren't currently offering in Swinomish, and the wellness program helped me get sober. It helped me get to treatment. It helped me get through some of those hard times. Here, we welcome them, and we welcome them with a smile. We know them by their first name because you're a person to me, and I enjoy those connections with people.
I had 3 of my siblings die from chronic alcoholism, and so that's part of the reason why this is part of me that I want to help others.
Our mission says to remove all barriers, so the individual has more of a success rate at a faster pace. So removing those things like, I don't have an ID, I don't have a way to get here, I have a child. What do I do then? Oh, we got Child Watch, right?
didgʷálič is a one-of-a-kind clinic. There's no stigma of drug addiction when they come here. Everybody's treated the same. They're treated like family.
Since 2017, we've expanded this place, made it 3 times as big as it was originally. There's 130 or 140 staff members here now.
So we started the program, and we were hoping for 3 years to achieve 250 patients. In 9 months, we achieved 250 patients.
It's a motorhome that has been rebuilt as a dispensary. It meets DEA regulations, and we have 2 dosing units on each mobile medication unit. And they'll be parked right outside on Division Street so that clients will be able to access them when their number comes up for dosing.
The arrival of the mobile medical units will bring care to hundreds of people, and it'll bring hope to their families, up to 400 patients per day can receive the medication that they need to get healthy again and to get back on track.
It's going to take all of us to try to heal and help heal each other's communities.
The partnership between the city, the county, their health department, and the Swinomish tribe are just an example of how we are all in this together.
What the didgʷálič Wellness Center in Bellingham will really add is an ability to get people into low barrier MOUD services 6 days a week.
It's not going to cost you anything to get in the door. We'll have someone on site there. There'll be a navigator there. And that individual will show you how to get through the process of didgʷálič.
We're bringing 26 staff members up to Bellingham. That includes security, ARNPs, physician's assistants, physicians, RNs, our toxicology folks, lab, and our dispensary staff.
You know, it's generational trauma. And when you heal a generation, they say it takes 2 generations to break a cycle. We are breaking the cycle. We are destroying generational trauma.
This is a place of hope. Just to walk through the door, that's hope. That's one step, right? Because sometimes they'll move 2 steps and then they'll step backwards again. But if they keep coming in, we're always welcoming them. The door is never closed.
What price do you put on a life? One life is worth more than the wages of 26 people, and we know that we give hope and we save lives. Many of our clients have kids. They're young people, and we're saving not only the mom or the dad, but we're saving the child too.
My dream would be to see one of these facilities in all 39 counties in the state of Washington. My dream would be to see these facilities in all 50 states in as many counties as possible, because it is a very unique operation and we're very proud of it.